The brain needs to have a rest period during the night to clean out metabolic waste. And that's called the glymphatic system. You've heard of the lymphatic, so you put a G on the front because of the glial brain cells. And what you learn is that that particular brain washing system works best when you're sleeping, and it works best when you're in your deepest sleep.
Hello and welcome back to A Safe Place to Land. My name is Emily and I am your host. On this episode, we are going to be interviewing Dr. Barry Crayco. He is a sleep medicine specialist and knows all things sleep and mental health. He's going to share today his research and talk about his book on how the quality of sleep over the quantity of sleep is going to directly impact your mental and physical health. We dive a little bit deeper into specifically how breathing through the nose can directly impact the quality of sleep that you have and ways to improve the quality of sleep that you have. Let's jump right in. Good morning. How are you, Barry?
Morning.
We are here with Barry Crayco. He is a doctor who specializes in sleep medicine, and we are going to just jump right in and hopefully learn a lot about how sleep and mental health are connected. So, Barry, tell us a little bit about why you decided to specialize in sleep medicine.
Well, that's a long story that might put some people to sleep. So I'll give you the abbreviated version, which is that I began working in the Department of Psychiatry, even though I was an internist at the time in the University of New Mexico, and they were working on a project to treat chronic nightmare patients. So I got involved with that research, and from that time forward, 1988 forward, everything I ended up doing was geared towards working with mental health patients with sleep problems. And just to give the spoiler alert here, when we did this work on nightmare treatment, which was revolutionary, we showed that you can decrease or eliminate nightmares with a cognitive imagery technique. We had no idea we were looking at the tip of an iceberg. And what I mean by that was people who have nightmares, especially chronic nightmares, almost always have complex sleep disorders along with the nightmares. So we call that nightmare triad syndrome. We've published on that in a few places. And what we've particularly found, which is very alarming, yet it's great we're learning about it because it's information we're going to use, the average chronic nightmare patient, particularly those with PTSD, also suffer from not just insomnia, but sleep apnea. And we were stunned to find that out in the 1990s as we were working through that research information. And since then, I've published two books. One was called Sound Sleep, Sound Mind in 2008. And then my most recent book is called Life Saving Sleep. And that book, which the subtitle is New Horizons in Mental Health Treatment, this is really what's going to happen in the field of mental health. There's going to be this incredible influx of information into the training programs for psychiatrists, psychologists, therapists, because they have been unfortunately missing the boat and not realizing this sleep angle is so big.
Wow. That is so incredible and so relieving to hear because, as I'm in my training right now, we do skip over sleep. We only talk about how, yes, you need 8 hours. Yes, being on a good routine is good for you, but we've never connected the dots that, nightmares could.
Let's start with that comment, the 8 hours.
Yeah.
Okay.
Yeah. Let's go.
So absolutely a problem to be talking to people about the number of hours of sleep they're getting. It doesn't really help that much unless you're talking about really high functioning people who have very mild sleep deprivation because of a schedule problem and they can't get the number of hours of sleep. when you talk about being in the field of mental health, you're working with very complex people who are suffering tremendously. They have tremendous mental anguish. It goes on oftentimes for years. It's rare you meet somebody who's had something for a couple of months and this is the first time they've seen somebody. It's rare you meet somebody where you cure them and then they're good to go for, 10 years. Many of these people suffer chronically, and I'm convinced that one of the reasons they suffer chronically is nobody is actually addressing their sleep problems. And this is why sleep quantity
Mm,
is a very poor metric.
mm,
Where the action is, and this is what I've been describing for 20 years now in both of my books,
mhm,
it's sleep quality. You
mhm,
have to know what is actually going on inside somebody's brain because that's what sleep quality means. What
mhm,
are your brain waves actually doing while you sleep? So, just to give you a very practical example, most people with sleep problems are intuitive enough that if you said to them, I'm going to give you a choice, you can get 8 hours of the sleep you're currently having, or I'll give you 6 hours of the highest possible quality of sleep
mhm,
so that after 6 hours, when you get up, you're going to feel great. Which one do you want?
mm,
And of course, people are going to pick high quality, but they're not given that choice. They're actually told, as you just described, you're learning something in a training program that believes that hours of sleep is a key metric.
mhm.
Whereas in mental health patients, it's largely something that you look at downstream only after you've worked on the quality of sleep.
Wow. Yes, I could not agree more. Even just thinking about clients who, drink alcohol or smoke weed, I have done a little bit of my own research to see that even though they are getting sleep, it's very poor quality and they're not getting
Right.
into that REM sleep and they're waking up a lot and they're moving around a lot and they're waking up fatigued and foggy, and even though they're getting hours, it's not good quality.
Right. And what you're pointing out is the exact phenomena that's caused by poor quality sleep and where people really have trouble embracing this. And usually you have to do it with pictures. And I've got lots of pictures of it, schematic graphics, in the book, Life Saving Sleep, is that the sleep is being fragmented. And most people say, well, what does that mean? What do you mean my sleep is fragmented? You say, well, if you imagine some brain waves being some sinusoidal up and down waves that look very rhythmical and relaxed, you go, okay, I guess that could be good sleep. Well, what happens then if all of a sudden in the middle of that, your brain does this and it has this arousal
Mhm.
activity? And so, what you're talking about specifically, when you mention all those symptoms, that was a very good description. We're going to probably have to recruit you to come into the field of sleep medicine.
Hey, I mean, what can I
You're
say?
you're young. You're young. You've got opportunities here. Sleep is going to be very, very big in mental health. So
Yeah.
there are going to be options for you. Actually, there's already options for people who are, for example, nurse practitioners and physicians assistants, but there's also an option for you called behavioral sleep medicine. So we can talk about that in a bit. But what I'm getting at is this fragmentation, these arousals, they're occurring hundreds of times per night, hundreds. So instead of
Mhm,
you getting qualitative sleep, where you go
mhm,
into delta sleep, deep sleep, or as you mentioned, going into REM sleep,
mhm,
those sleep periods are to be consolidated.
mhm,
So if you go into REM, you want that REM to last 15 minutes,
mhm,
25 minutes. You don't want arousals breaking that up. And some of
mhm,
those arousals lead to awakenings. These
mhm,
people often will say to you things like, oh, yeah, by the way, I toss and turn a lot. I wake up a lot during the night. I go back to sleep, but I just keep waking up. That if they were to sit in front of a computer screen, and this is what we did in New Mexico when we had
mhm,
our own sleep center for 20 years, after the test, brought the patient right into the tech control room, sat them down next to the sleep tech, put it up on the screen, and said, this is your sleep.
mhm.
And they go, wait, that doesn't look like very good sleep. That's right. It's horrible sleep.
Yeah.
It's fragmented, and you're waking up all night long. And they're going, really? Nobody's ever told me this before. Nobody has ever shown me this before.
Mhm.
And so that's how you break through
Mhm.
this particular barrier for the patient. But the
Mhm.
funny thing is, I'm sitting here talking to you. You're saying, gee, this sounds interesting, but what does this actually look like? And
Mhm.
until you go to a sleep center and say to a doctor, will you show me what's going on in your lab here? Can I see what it looks like for somebody who's got leg jerks or night terrors or sleep apnea or
Mhm.
fragmented sleep? You want to do all of that. And then you go, wow, this is a physical problem destroying the mental health of my patients. And
Mhm.
as we saw that, we're going, this is just monumental. We got people sitting in front of us who've been having these problems of insomnia for 20, 30 years, all kinds of medicines thrown at them. And it turns out they've got this problem.
Wow. That is just so incredible that you guys have been able to look at it for the patient on the screen and they can finally see what's going on. Because I like what you said, a lot of the times they have no idea and they've never been able to connect the dots.
And what are they hearing, for example, from their psychiatrist, their psychologist, from the therapist? They're hearing, well, if we just treat your PTSD, if we just treat your anxiety and depression, I think there's a very good chance that your sleep is going to get better. And the truth is, some people do discover that the treatments for anxiety, depression, and PTSD make sleep somewhat better. The problem is that the mental health community doesn't have a good measuring stick
Yes.
to know what better is.
Mhm.
So they often think, oh, well, it's a little better. Oh, well, then we could try this other medication because then maybe that'll make it more better. And oh, we could try some sleep hygiene, or we could try whatever it is. They're missing the boat. It's a physiological problem in the brain
Mhm.
that is absolutely destroying their sleep. And just to be very clear, this is brain damage. This is
Mm.
not some, okay, well, you'll get some more sleep one day and then you'll feel better. No, this is brain damage. This is a precursor to significant memory loss. For the older groups, it's a significant risk factor for dementia,
Mm.
for strokes, for cardiovascular disease, all physiological pathology that is going on in mental health patients. You're going, how are all these doctors missing this? I love to tell the story because I have something of a happy ending. I've been talking to some of the most prominent mental health hospitals and facilities in the world for more than 20 years. And every time I get into contact with them, I say, by the way, you have to install a sleep center in your program because your mental health patients, you just can't keep referring them out. The sleep doctors don't really understand this that well. You have to make your own sleep center. Up
Mhm.
until just a couple years ago, nobody would do it. They all
Mm.
said, well, we can't do it. There's no reimbursement for us. There's no billing codes, all this administrative stuff. So a year ago, 2 years ago, I moved to Savannah and we have a psychiatry residency training program here. And that's exactly what we're doing. We've installed a sleep medicine curriculum for the residents. We actually run a sleep clinic inside the Department of Psychiatry to train the residents on how to evaluate sleep patients. So that's a really big step. I don't know yet how far we're going to get as far as sleep testing. That's another bigger hurdle. But the Menninger the Menninger, very, very famous Menninger facilities in Texas, Houston, Texas, that facility put in just a few years ago a sleep lab for their patients. So that's a big deal. So that's two, and that's more than zero.
That is more than zero. No, that's amazing. I would love to come to Savannah and have you test my sleep, and so I can see the quality of sleep that I'm having. I think that's so important. And so, my next question for you is, what does treatment look like for someone who is having poor quality sleep?
So the good news is that the mental health community has so much they can learn that parallels information you already have. So, for example, we developed imagery rehearsal therapy, IRT, for Chronic Nightmare Treatment in the early 1990s published a major paper in JAMA, randomized controlled trial, rape survivors with PTSD and nightmares, where not only did their nightmares get better, but their PTSD got better. To my knowledge, that is the first major randomized controlled study published in the scientific literature showing that if you aggressively treat a sleep disorder, because remember, I'm a sleep doctor now. So when you say nightmare, I say nightmare is a sleep disorder. You're in mental health. You would say, well, isn't nightmare a mental health disorder? We don't have to disagree on it. I'm just giving the terminology. So, from our point of view, we published this data. It showed that you treat this sleep disorder nightmares, the PTSD scores dropped. And you know how much they dropped? In the same year, people were doing research on the use of Seroquel to treat PTSD. And that became a mainstay treatment and still is for many doctors to prescribe it for PTSD. Our study with imagery rehearsal therapy, which comprised approximately 7 to 9 hours of group treatment over 3 sessions, that led to the same size treatment effect as if you had given somebody Seroquel and no side effects. So imagery rehearsal therapy is very powerful, but also because you're treating nightmares that your PTSD gets better. So that's one. Number two is CBTI. You probably heard that term, cognitive behavioral therapy. And then they put the I at the end for insomnia. And so that's a very well-researched, evidence-based program for how you basically cognitively structure a person's thinking about sleep. It has to be done the right way. It is often not done the right way. It is often done poorly in ways similar to the way people apply sleep hygiene steps. You really have to have a much better working knowledge of sleep medicine in general to apply CBTI more effectively. And then you also have to know that if you're doing CBTI or nightmare treatment in somebody who has sleep apnea and the sleep apnea is untreated, you've got to ask yourself the question, do I need to change things? The good news is we know that IRT and CBTI do work in people who have sleep apnea. People have published that data. And those are people, of course, from the mental health community who wanted to prove a very important point that they didn't have to treat the sleep apnea first because that was going to kind of mess with their whole job. So they got this research done and they showed you can do IRT, you can do CBTI. Nonetheless, I only say that a little bit humorously because what we learned at our sleep center was even though all these patients were coming to us with mental health problems, insomnia, nightmares, we started most of them on sleep apnea treatment. Why? Because people in mental health love to hear the following words. You have a physical disorder that's causing part of your problem. And they go, what? Yeah, you have a physical disorder that's actually causing some of your anxiety, your depression, your PTSD, nightmares, and some. They go, well, I'm all in then. I want to treat that. So many of these people, we were stunned. You know, CPAP is one example, is a very difficult thing to get used to for many people. And CPAP is, the main treatment for sleep apnea. You would think people would not jump for that because they go, who would want to start CPAP? But it's the ringing in their ears of, I have a physical disorder. This is something physical. This is not my fault. This is physical. I want to treat it. And so they really have tremendous momentum. That momentum, I'll just close this point by saying that momentum we learned very quickly in the early 2000s gets shut down because CPAP is too difficult to use. And so we switched, and I talk all about this in Life Saving Sleep. We switched to more advanced models of PAP therapy called bilevel. And once you do that, it's much easier for someone to learn to use that treatment. So I know that was a lot, but that gives you a good overview of how you can really blend psychological and physiological disorders. And that's what I personally believe is the wave of the future, that each person will be given the chance. You can get all these therapies at once because they're all going to make your sleep better.
Yeah, absolutely. And I think that just highlights how connected our mental and physical health are. And on top of that, just having clinicians being properly trained and specializing in sleep disorders and sleep medicine. Yeah. And I wish that we got more training as therapists about, screening for all the physical stuff before we start jumping to other things. Because I think the physical, sleep, diet, exercise, that needs to come first.
Right. That's a great point. And you would think, since those ideas, not so much the sleep, but diet and exercise ideas have been around for decades now. I mean, we are a very sedentary society, and we pay a huge price for that.
Mhm. Yeah, most definitely. And I think it's going to change everything if we can get, specialists training for, different programs across the US for mental health clinicians. So tell me
You-
a little bit about some of the side effects of getting poor quality sleep. I know you mentioned PTSD and anxiety, but what are some other things that typically show up for people struggling with their sleep?
Well, the main thing for people to learn about that drives the problem of symptoms, the ones we're most concerned about with mental health patients, which would be attention, memory, concentration, mood, irritability, reactivity, all those sorts of things. The brain needs to have a rest period during the night to clean out metabolic waste. And that's called the glymphatic system. And I don't know that you're being trained to learn about that yet, but
Never
that
heard of a lymphatic system.
right, right. It's you've heard of the lymphatic, so you put a G on the front because of the glial brain cells. And what you learn is that that particular brain washing system works best when you're sleeping, and it works best when you're in your deepest sleep.
Mhm.
So now you can see the double whammy. Not only are you not getting enough sleep with your mental health problems, but you're not getting enough deep sleep. And so when you think about that, again, you're being told by the patient is being told by way too many providers, well, of course you're not sleeping well. You have PTSD, you have anxiety, you have depression. But the real problem is that the brain itself, by not sleeping well, not removing the metabolic waste that's there, is absolutely having an impact on all of the symptoms we're talking about. Memory, I mean, the physical symptoms too, but the ones for mental health patients, memory, concentration, mood, irritability, reactivity, all of these symptoms that allow a person to cope better, to come up with better judgments and decision making. All of that is knocked down because the brain isn't cleaning itself at night. It's not able to because it's not getting either enough sleep, but usually it's because they're not getting enough deep sleep because that's what
Mhm.
they know. Delta sleep is where the glymphatic system works the most powerfully.
Wow. Yeah, no, that definitely makes sense. We all need to have our brain washed. We're like iPhones. We need to be put into our charger at night. And if we're not getting that
Right.
overnight recharge, then we're gonna be all out of whack in every single way, physically and
Yeah.
mentally. And so
Yeah. It's so funny though that people don't understand your beautiful metaphor because what like a phone, you think a phone is anywhere near as complicated as a human? And we're a billion times more complicated than a phone. And so what? We don't need to be recharged? Oh, we should just be able to go on without. No, we need to be recharged, and you do it through sleep,
Mhm.
high quality sleep, so that your brain actually gets the right cleansing it's supposed to go through during the night.
Yeah, absolutely. And I know it's not feasible for everybody to have the opportunity to go to a sleep research hospital and get tested. And so, what are some more kind of like realistic changes that we can start implementing now to improve the quality of sleep that we have?
Well, some technological things are actually making headway such that literally anybody can get a sleep test now. Some of them will be not great quality,
Yeah.
but they will be at least something moving us in a certain direction. You can even I mean, they'll have stuff on an Apple phone soon enough that'll say, we can test whether or not you have sleep apnea. That test won't be very reliable, except that if it's positive, more than likely it's true. There's all kinds of wearables. There's all kinds of new inventions coming out. You put a little monitor taped to your forehead. There's another one you can tape to your chin. There's one that's a ring. As these things get more evolved, they will actually be able to measure very closely brain waves, breathing patterns, and hopefully even leg movements. So right now, a person could go and look online and find ways to get a variety of different tests. Some of them are actually covered by insurance. They have to do it through a sleep program, but many of the sleep programs now are moving in that direction. So you get these home tests. They're called ambulatory or home testing. So no, that's very, very straightforward. And virtually anybody can get that test nowadays. One way or another, they can get information to say, oh, I just did this little sensor thing and it showed that my sleep is really light. Gosh, I wonder if that means my sleep is fragmented. I wonder if I should go to a sleep center. And the answer, of course, is yes, 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 go do that. So those options are going to be available. But in the meantime, what people like to hear is what I call early conservative treatment of the single most common sleep fragmentation problem. You know, in my book, I've got all of this stuff, the stuff I'm going to talk about now. I also talk about the nightmare treatment, like how to do IRT. I talk about CBTI, how to address insomnia that way. But in the book, I also focus on the fact that the single most common cause of sleep fragmentation is going to be in your breathing. And so it turns out you don't have to sit around waiting to try a PAP machine, because that process is the one that does take time. You got to find a sleep center, you got to get tested, and this insurance has to approve the device. It goes on and on and on. It's a very complicated, messy affair that actually turns off many people. Back in the day, in the early 2000s, when we were looking into all this, we said, I wonder if there's simpler ways to treat people, not because it's a cure, but because if you move them in a direction where they go, gosh, I did that and I'm sleeping better, that really sounds like that could be really important. Maybe I should look into this. So, what am I getting at? Well, we did a study in the early 2000s where we put insomnia patients who we didn't even have to test them. We just took a careful history, looked in their throat, and we knew they had a sleep breathing problem. But we didn't tell them that because this is 25 years ago. We just said, we're doing this study and we're curious to know whether breathing might help you sleep any better because you say you have insomnia. But we didn't say to them, we think you have sleep apnea. We just said, this is what the research is for. Anyway, we put 40 people into the wait list control. They didn't get anything except a little bit of education, I think, on sleep hygiene. The other 40 people wore nasal strips. In the first month of the study, the average use of the nasal strip, meaning did you put it on every night, was 28 out of 30 days for 40 people. So this is a tremendous level of, I don't know if you call it treatment fidelity. I mean, they use the treatment. And at the end of the 3-month window, when we looked at the data, there was virtually no change or worsening in the control group. In the treatment group with nasal strips only, 75% out of the 30 people actually reported that their insomnia was clinically better. And I'm talking about on a scale. The Insomnia Severity Index is the most widely used research scale, and 75% of them had clinically meaningful impact. And these people were coming up to us, for follow up, like getting, like feedback, like this is amazing. I mean, how is it that this little nasal strip is making me sleep more through the night, making it easier to fall asleep, not necessarily getting up to pee, not waking up with a dry mouth. In other words, those are all things you hear about with sleep apnea. But we just gave them a nasal strip. So we've what's the word? We ballooned off of that, the fact, or balloon, we expanded the process by saying, well, what else can we do for somebody's nose? Because
Mhm.
that's where the action is in the early conservative treatment. So it turns out virtually anything you do for your nose has a chance to make you sleep better. It could be
Wow.
nasal saline rinses. It could be Sensimus nasal steroids. It could be antihistamine nasal sprays. Um, it could be going to an ear, nose, and throat doctor and getting septoplasty and turbinate reduction. It could be getting more aggressive treatment for sinuses. Any of those things is how we direct people in the early going to say, if you do this and you start sleeping better, you pretty much just diagnosed yourself. The only reason you're sleeping better is because you must be treating an underlying sleep breathing condition.
Wow. That is so amazing in so many ways. First and foremost, that this is so achievable, a nasal strip or even like a nasal strip with the mouth strip to prevent mouth breathing throughout the night. I mean,
Right.
that is
Right.
very attainable for anyone. And to know that regardless if you deeply struggle with your sleep, it will show improvements. Like that is very significant research that they were able to find. So and I don't know if
Right.
you know this, but they're promoting, those nasal strips and the mouth strips more for a lot of
Yeah.
jaw reconstruction because of the mouth
Right.
breathing and the side effects that come along with that, and sickness from the bacteria coming through your mouth as well. And so to
Hmm.
know that this has multiple layers of benefits, hygiene, bacteria and teeth and deep sleep. Like it's just it needs to be talked about more, I feel like, from physicians and mental health providers.
Absolutely. And the way you're describing this is so beautiful because you're talking about a triage process. In other words, why wouldn't you work with mental health patients walking in the door and discover, okay, let me have you fill in this quick survey. I'd like to know whether or not you suffer from allergies. Do you have any sinus problems? Do you have any difficulty breathing through your nose? Do you ever get congested or stuffiness? You're going to be, well, you won't be, but I mean, the number of people that report positive on these things in the mental health field, I'm sorry, the mental health, population of patients is between 50 and 80%. It's
Wow.
shocking. They're
Wow.
coming in with a stuffy nose, a congested nose, sinus problems, allergies, and they think that's my primary care doctor. No, I'm saying that is front and center sleep medicine, mental health. Let's get into it right away because this could actually make you feel better. There
Wow.
was research years ago, I think 100 years ago, that showed that if you have difficulty breathing through your nose, you will develop anxiety. Now, how could that surprise anybody? How could that not be true? And yet, here's all these people we're interacting with, stuffy noses, congested noses, and we're talking to them about anxiety and behavioral treatments, which is fine, cognitive treatment, which is fine, but they're mouth breathing in front of you, they're blowing their nose or they're sneezing, whatever it happens to be, and you're not sitting there thinking, wait, this is part of their anxiety. They can't breathe through their nose.
I mean, even with me having a good understanding of sleep connected to mental health, I would have never linked together that, wow, my client is really stuffy. I wonder if that's affecting their anxiety. That link has not connected for me personally, and I can say probably not for a lot of clinicians.
Right.
Um,
This
and
comes
so this
about through sleep medicine. Yeah, the people who got that were the people in sleep medicine. In other words, the most famous sleep researcher in the world, Christian Guilleminault at Stanford University, published on this idea about 10 or 15 years ago before he passed and mentioned that in the 19th century, they actually talked about nasal surgery. I'm pretty sure I'm saying this correctly. Nasal surgery to treat people with anxiety or depression.
mm,
So they
wow.
knew something about the way nasal breathing operated back then,
Yeah.
where they said,
Yeah.
yeah, this is part of the problem.
Wow, that's amazing. Barry, thank you so much for sharing all of this information. As we wrap up, I'm wondering if there's anything else that you wanted to tell us about your book. It sounds absolutely amazing.
Well, thank you very much for having me. It's been a great discussion. I really appreciate your very well-formed questions. And I think the discussion was going to help people see the directions that they can take. A few things in terms of resources that I'd like to recommend. Of course, my new book, Life Saving Sleep. You can go to that website, lifesavingsleep.com, or Amazon, or wherever books are sold. Of course, I always appreciate book reviews if a person does get a book. I also have a website, barrycracomd.com. And on that website, we sell books and videos, but we also have a lot of free resources. In fact, you'll love this. We have a free video session on the Barry Craco MD website, and it's called The Nose, Nose, Knows, Knows. It's a 1 hour program. It's 6 10-minute sessions, and it walks the person through in so much detail that they will learn the differences between what are called allergic and non-allergic rhinitis, why different people with nasal problems have to deal with them differently, different treatments. It's a tremendous way to get a head start and begin treatment. So that's on the website for free. The other resource that's on there that's very relevant for some of your clients, some of your patients, is I operate a sleep health coaching service. So because I have learned so much and have so much experience in the area, this particular program is very much designed for people who are failing other treatments. Like maybe they tried CPAP, maybe they tried sleeping pills, whatever it was, they're not making it. Now they're saying, I've tried all these doctors. Nobody seems to know what's going on. Why don't I consider a coaching session with Dr. Craco? Because what I do is I put all of those failed treatments together to explain why they didn't work. And then I create a new roadmap for them saying, here's how you can go forward working with another sleep doctor or whomever. So people have been very much benefiting for these coaching services. And then the last thing is I have a free newsletter. It's called Fast Asleep, the substack.com. So it's fastasleep.substack.com. And there, every week or so, I will comment on something new in the field of sleep medicine. So
Amazing.
those are my resources, and look forward to hearing from maybe some of your clients. By the way, I keep forgetting. How far away from you are you guys from Savannah? Sunshine.
Probably like 8 hours. We're like right under Tampa. St. Pete is like just south of Tampa. So,
Yeah, I think it's we had to drive to Sarasota 2 weeks ago, so
oh
that
wow.
was a 6 hour drive. It was a 6 hour
Oh,
drive.
okay. Yeah, Savannah is
Yeah,
actually probably a little closer. So yeah, definitely. So maybe like five, yeah, 5 or 6. So yeah,
yeah.
not too
I was
far.
I was I was gonna say that. Yeah, I mean I don't know what your facility is like or your community, but if you want me to come down and give grand rounds or a training seminar, that's something that certainly is workable.
Absolutely. Yeah, we will definitely have to connect and
Yeah.
talk more about that. But thank you so much for sharing. We really appreciate it. And yeah, wonderful. Thank you so much.
You're welcome. Have a great day.
You too.
Thanks so much for spending some time with us here on A Safe Place to Land. Could you do me a favor really quick? Could you leave us a review wherever you are listening to this and subscribe so that you never have to miss an episode whenever we drop it? If at any point in time you're like, man, it would be so cool to work with the team at Sunshine City Counseling, you can always find us at sunshinecitycounseling.com. We serve the state of Florida, and we are located in the downtown community of St. Petersburg, Florida. If you are in or around the Portland, Maine area, you can find us at easternshorecounseling.co. We really believe that every single person is deserving of excellent mental health care. You are not a problem to be solved or fixed. You are a person to be served. We are here for you, so don't hesitate to reach out. Until next time, we'll see you guys later. Bye.